It's 1:02, so let's begin. So welcome, everyone. Good morning, good afternoon, good evening. I'm Supriya Bezbarwa from the WHO EPI-WIN team. Thank you so much for joining this WHO EPI-WIN Wednesday webinar. Today, the topic is Getting PRET for the Next Pandemic from National and Regional Experiences. PRET means ready in French. It's also the acronym for the program Preparedness and Resilience for Emerging Threats. For those of you who are new to EPI-WIN, it's the WHO Information Network for Epidemics. It's a platform for science and knowledge translation in health emergencies. And our goal is to make the science accessible, understandable, and relevant so that people can make evidence-informed actions and decisions. Today, we have a great panel to share regional and country experiences from PRET, led by Dr. Sylvie Briand, Director for Epidemic and Pandemic Preparedness and Prevention at WHO, and Dr. Gina Saman, who's the unit head. She's leading PRET, and she will introduce the speakers and moderate the discussions. Before handing over to Sylvie, I have a few housekeeping announcements. First of all, that this webinar is being live streamed on EPI-WIN YouTube, so you can see it there. It's being recorded, and afterwards the recording will be available on our website webinar. Interpretation is available. So we have interpretation today for Russian, Portuguese, Spanish, Arabic, and French. And yes, I think those are the languages. And we invite you also to post your name, location, organization in the chat box. But for your questions, which we very much welcome, please put your questions on the Q&A box so that we can respond to it. And finally, a new development based on your demands, because many of you have requested this, we will be providing certificates of attendance for those of you who stay throughout the webinar and also answer our survey in full, which you will receive at the end of the webinar. So without further ado, I now request Dr. Sylvie Briand to provide the opening remarks. Over to you, Sylvie.
Thank you very much, Supriya, and thank you to the team for organizing this webinar. Thank you also to all national and regional counterparts who have engaged in a PRET rollout. So today it's about preparedness. It's a webinar about preparedness and preparedness for the next pandemic. And I would like to quote this that was said to me by my former boss, but I think it's a very well-known quote. It's, if you fail to prepare, then you prepare to fail. And I think this is a really important lessons learned from previous crises, is that we really need to get prepared. And let me give you some of my experience. In 2015, South Korea faced an outbreak of MERS, the Middle East Respiratory Syndrome. They were not very well prepared. And although this outbreak was a small outbreak, in a sense, because it was only 186 cases and 38 deaths, it really had an enormous impact on the country. Because at some point in time during this outbreak, up to 1,381 schools were closed. And the loss in economic terms was around $8 billion for just few weeks of outbreaks. After this bad experience, South Korea decided to be better prepared for the next crisis, and they invested in preparedness. And this explains why in 2020, when COVID-19 started, this country, although being one of the first affected countries by COVID-19, they reacted extremely well and were able to implement rapid testing everywhere in the country and to trace contacts and to reduce the impact of the first wave on their economy and society. Before COVID-19, there were 92 countries in the world with an updated preparedness plan. But in 2020, 177 countries prepare the plan for response to COVID-19. So everybody nearly, or every country in the planet has some experience in preparedness. But maybe we should reflect after COVID-19 on how should we get better prepared. Of course, we need to learn the lessons from COVID-19, but at the same time, we cannot get prepared for the past crisis or the last pandemic. We need to really look at the future. And I would give you 3 comments or insights that I gained from my experience. The first one is that we need to integrate innovation. During COVID-19, we have seen new apps for contact tracing. We have seen rapid tests. We have seen genomic sequencing, wastewater surveillance, and, for example, social listening also for infodemic management. So we need to incorporate all those innovation and new tools into a pandemic preparedness plan to make sure that we can use those innovative tools for the next pandemic. The second thing I learned from experience is that it's very important to have a resilient health system, because the health system, a good care, will enable to reduce mortality. Even when you don't have specific treatments or when there is no vaccines, by providing good supportive care, you can really reduce mortality to any kind of disease, even disease X. So it's very important that we have a very good resilience health system for the next crisis. But unfortunately, this also has to be part of the preparedness agenda, because you see that after COVID-19 crisis, many health systems have suffered a lot during those 3.5 years of crisis. And now we need to recover and rebuild the health system with a good health workforce to make sure that we are ready for the next pandemic. The third point is that we need to plan with different scenarios, because of course, the normal wisdom says that you have to prepare for the worst and hope for the best. But I think it's not necessarily the best approach. Of course, we have to get ready for the worst, but also imagine that the worst may not come, and we need to have flexibility to make sure that we are not implementing measures that are too extreme and too strong compared to the risk we are facing. So that's why we need scenarios to retain flexibility, to calibrate also the control measures and avoid lockdowns if they are not necessary, avoid closing school if it's not necessary, and so on. So very important to have this flexibility. And we need also to use different scenarios to make sure that we can ensure better equity. And different scenarios will help us to make sure that within countries and between countries, the most vulnerable can be protected and can be supported during any kind of crisis. So Gina Saman, who will manage the discussion, will also introduce what is PRET for those who have missed the previous webinars. But today, what is very important is that you will hear from different people and different experience from national entities, ministries of health, but also from colleagues in different regions in the world, so that we can exchange experience and learn from each other and see how we can all together get better prepared, getting this inspiration from our colleagues around the world so that we can improve, but also scale up our preparedness plan so that we are really all together much better place for the next crisis to come. So with this, I give the floor back to Supriya or Gina to manage the rest of this webinar. And thanks again for joining us. It's a real pleasure to be with you today. Improved, but also scale up our preparedness plan so that we are really all together much better place for the next crisis to come. So with this, I give the floor back to Supriya or Gina to manage the rest of this webinar. And thanks again for joining us. It's a real pleasure to be with you today.
Thank you very much, Sylvie.
But also scale up
our preparedness.
Maybe Supriya, I will take over and you can mute at this moment. Thank you very much. Colleagues, welcome. We have 162 registrations, 162 countries registered to participate in this call. And as I'm seeing in the comment boxes, someone from hot Qatar, someone from Bhutan, someone from the Australian Capital Territory in Canberra, Australia, someone from Bolivia and Peru. Welcome to all of you. The momentum around pandemic planning is there. Thank you for making the time in these ends of time zones for this call. It is ultimately your energy, your inspiration that is making this happen. Now, I do need someone to tell me if you can see my slides. Can someone confirm for me?
Yes, we see them well.
Thank you, Shoshana. Colleagues, I'm going to set the scene very quickly in case you have not heard about PRET, getting ready for the next pandemic. And then we will turn to a presentation from our African regional office, then followed by a country panel discussion with 3 countries to share their experiences. So let's get started. What is PRET? PRET is a new approach to improve pandemic preparedness planning for groups of pathogens based on how they transmit, on the mode of transmission. And the idea is that we're constantly navigating to adjust our systems, to build our capacities using what we have, what exists, and to elaborate over time. So that is the concept of PRET, mode of transmission pandemic planning. Why take this approach? This is a slide that's commonly shared. You may see it on our website as well. The idea is we try to be efficient. We try to be functional by building on what exists. We try to be risk-based by saying there are pathogens that we know cause pandemics and pathogens that may come at us that we are not familiar with, a pathogen X. It is trying to be collaborative and innovative, especially on the heels of COVID-19, where many innovations were introduced, and the opportunity is to sustain and make that part of our resilient systems. So as we think about PRET as a concept and where we stand facing the COVID-19 pandemic, we thought the first place to start is respiratory pathogens, the respiratory mode of transmission. So here are my favorite lungs that you see on screen. And the idea is that this is PRET Module 1, respiratory pathogens. So what does this module provide? It provides a new organizing framework with operational stages, triggers and assumptions for planning and preparing. It provides key actions organized in what we call the 5 Cs, and I'll elaborate a little bit about this. There are 3 tiers for how we strengthen preparedness: cross-cutting, foundational capacities, pathogen group capacities, and then the pathogen specific. Also, the module outlines approaches and ideas of how to take a whole of society approach. As we learned with COVID, whole of society engagement is critical, multi-level engagement is critical, and it provides tools and resources to help all countries and stakeholders in pandemic planning. The idea here is to have collaborative platforms to support countries and partners to develop, test, and update plans. The idea is that we work together. So please, if this is the first EPI-WIN webinar that you join us in PRET, please know it will not be your last. Please join us in future ones, and you will see all of them recorded and put on the website for record and to keep us building together. So be ready to engage in future. We currently get asked by stakeholders, what does this module do? Does it help strengthen our preparedness or our response planning? And what we actually say is it does a bit of both. What it does is it provides a contingency plan of what you do when an event is detected, when there's sustained community transmission, when that transmission is disseminated in different places. But it also says, right, well, that's what we do during those response phases. What do we have to do now in the inter-pandemic phase to prepare, to be ready? So it addresses both preparedness and response planning needs. So what is this organizing framework? Well, on the basis of it, we are constantly working together to strengthen the foundation of resilient communities, multi-sectoral systems. And I could see on the call that there are health authorities from ports, airports, welcome. Travel and trade are critical, other institutions. So truly this multi-sectoral thinking is absolutely essential. Welcome to you all. Core capacities for emergencies, what does that look like? That's our foundation. Then we think about having ongoing surveillance, this ability to detect an event, to look at trends, to monitor, to detect aberrations at the subnational, country, regional, and global level, to constantly monitor and risk assess. So then, overlaying that are the following. We have the interpandemic period, during which we are preventing and preparing. A lot of the One Health approaches and systems are critical at this stage. During the early detection event, an emergence of a new pathogen, then there is the initial response. Then we prepare for and make our contingency response plan for when there is sustained community transmission. We continue to be in response, but with an elaborated response. There may be also disseminated transmission. So beyond one community, beyond one country, beyond one region, there may be the global action needed. Again, continuing the response. And the idea is if we hit that situation, we don't sit back, we don't stop, we must keep going. The response actions adjust and may change in what we do, but the idea is to continue elaborating that response. Then we come down to a situation where the situation may have stabilized, and we start our recovery processes. And then we reemerge back into interpandemic period where we are back in prevention and preparedness. So this is the organizing framework, and the idea is it helps us plan for what we do when. All the time thinking, what do we build? What do we strengthen? What do we make resilient here and now in the interpandemic period? So we're going to hear from countries, their experiences. It's quite exciting to have an array of countries from Lebanon, Switzerland, Mexico. So we're very excited to have the panel discussion with them today and really the steps that they've taken. We are advising countries to think about preparing, analyzing the context and the situation they're in, drafting their plan, finalizing, testing their plan, and of course, implementing those actions to help them continuously strengthen preparedness, monitor, and improve their preparedness and their planning. How do we do this? Please know that there's a series of resources that are either already available or that will be available. So the module 1, focusing on respiratory pathogens, is in hand. It's in the website. An associated checklist with more detail is coming your way very shortly, with great thanks to colleagues who worked on that. And thirdly, an M&E framework, monitoring. How do we know that our preparedness systems are improving, elaborating over time? We need to monitor. Fourth, simulation packages and advocacy tools. Packages exist, please contact us. We'll connect you with the right teams, with the right agencies, if you would like simulation packages and advocacy tools. And we plan to work with partners to develop a global implementation roadmap. Again, all with the intention, as 162 country representatives signed up for today, to row the boat in a common direction. Thank you for the engagement. And of course, there's analyses of COVID-19 lessons to help gauge and inspire where we go next. That's resources. Here now is methods for us working together. So welcome to these EPI-WIN webinars where we're transferring information, sharing knowledge. We hope to soon have an online community of practice where we can share resources. We hope to establish a PRET network in the coming months where country leaders can come together and think about the challenges they face and the solutions that can be implemented. And we have a PRET website. Please visit it for normative tools and products. With great thanks for the partners who are engaged in an engagement forum to share their experiences, their programmatic updates, and to collaboratively work with countries and stakeholders on the rollout of pandemic preparedness planning. And lastly, workshops and meetings that are happening all over the world. And so if we look at that, this is a very proud slide for the team of pandemic planning. We launched this initiative in April, a call to action for all countries and stakeholders to move forward with the next era of pandemic planning. 1 month later, 54 countries from 5 regions had already started updating their pandemic plans. 1 month later, that is really something to be congratulated. It's an immense effort. And more exciting is in the next few months, by the end of this year, 100 countries from all 6 regions of WHO will have started updating their plans. So in advance, congratulations. We will hear from 3 countries today, their experiences, and we really hope we can share more in future. Don't hesitate to reach us when you have something you would like to share with the global community. This gives you a snapshot of what's happening where activities have commenced, in which regions and which countries, and where activities have been planned. And again, this is time-stamped as of May 2023, but you can see that this is moving at an incredible pace and will continue to keep updating with our regional and country colleagues. With that, I hope that has reintroduced you to the concept of PRET, the tools, the resources, the opportunities. And I would really like to, again, congratulate countries for the momentum that has kept up with pandemic planning, partners who are engaging, and of course, our teams at WHO who are driving this in their regions, working with partners and countries. I really am grateful for your efforts and engagement. With that, let us now move on to hearing from those who are doing. So let me introduce Dr. Belinda Herring. Belinda, I hope you can come on screen. Welcome, Belinda Herring. Thank you, Belinda. Technical Officer in Preparedness in the African Regional Office of WHO. Belinda will be sharing with us the regional experience of rolling out PRET in the African region. I hope her slides can come on screen now. And Belinda, over to you.
Thanks very much, Gina, and good morning, good afternoon, and good evening from wherever you are. I'm very happy to be here and provide the experience that we've had in the African region of rolling out this initiative. Gina, they're not coming up on my screen, should they be? And do I just say next slide?
They are on their way. And yes, yep. Please say next when you are ready.
So the first slide, I think should. That's the second slide. Oh, okay. So that's the first slide. So once again, good morning, good evening, or good afternoon from wherever you are. And I'm going to provide some experiences that we've had in the African region. So next slide, please. So we started our pandemic preparedness planning back in 2018. And that was part of the pandemic influenza preparedness framework, where the goal is to have countries that have developed or updated their influenza pandemic preparedness plans. And the PRET initiative is perfect timing, as it's come on the heels of the COVID outbreak. And so it allows us to sort of reset and start again after what we had done with regards to advancing the influenza pandemic preparedness plans. Next slide, please. So as looking at the PIP pandemic preparedness, we had done workshops in these 16 countries, and this was pre-pandemic. And so then we had the pandemic, so everything stopped for a while. And then next slide, please. And so we've restarted our pandemic planning with the PRET initiative, which is similar to the approach that we took with regards to the plan architecture that we took with when we were doing it with PIP. And our approach in the region hasn't changed very much. So in this region, there's 47 countries. So it's quite large with varying degrees of sort of preparedness and capacities. And so and people are very stretched very thin. So having people at a workshop together is a great opportunity to have the different sectors together. And, it's a unique opportunity for them to sit down and talk with each other. So our approach is focused around sort of multi-country workshops as a starting point. So the first step has been to engage with countries. And so looking at country offices, talking with emergency preparedness focal points, disease prevention and control people, and, an infectious disease focal point or maybe a COVID focal point. And we ask countries before they come to a workshop to identify all the relevant documents that they may have which may help them. So that includes a national action plan for health security, any previous plans that they've had for influenza pandemic planning, their all hazards plan, JEE, any SPA results, which is the state party annual reporting on IHR core capacities, and their COVID response plan. So they have a whole cadre of documents to identify, what is there, because this is going to build on what is already there, as Gina had mentioned. So in the regional office or in a country, we host a multi-country workshop. We usually invite around 5 people from each country and the country office focal point, who is going to be our champion moving forward, and ask people from different sectors so that we end up with sort of a range of emergency response and preparedness people in the room for each country. So then the country teams are mentored. We have a number of facilitators, and they're mentored to develop a draft 0 of a plan. So the goal and the outcome of the workshop is that they take away something that is the skeleton of what they can build on. Because, one of the things we reinforce is they're not going to start and finish this in a short number of days. This is something that requires greater engagement with a greater range of people. And we draw on that from their COVID experiences and how many people they needed to, and how many different sectors needed to be involved in the COVID response. So you need to engage them in preparedness planning. So the next step is, once people go back to their countries, the regional office will support them to help them finalise their plans. And that may be through multi-sectoral stakeholder workshops or simulation exercises, or, whatever they need. If they want to join and be one of the champions for PRET, engage with other countries to find out their experiences, we're really open, but we want to be supportive to help them finish their plan. Next slide, please. So to date, we've had 3 workshops in the region. The first one was an Anglophone workshop, or one for English-speaking countries. It was held here in the regional office, and we had back-to-back with that, one inviting the Francophone countries, or 6 Francophone countries. And then just recently, we've been to Cabo Verde and did a workshop with all 5 Portuguese-speaking countries, which was terrific. Next slide, please. The format of each workshop is fairly well, is similar. And I have to be honest, it's been a learning experience for us at the regional office as well. So you learn as you go on how better to do things with different groups of people, because some countries come with a influenza pandemic preparedness plan that they're aiming to update, and some countries come with 0. They haven't actually even thought about it. So it's been a learning experience for us as well. So it's a 4-day workshop. On the first day, we talk about the PRET initiative. We look at their COVID experiences, what were good, what were bad, what they can take forward. They're introduced to the preparedness landscape and the 5 Cs, as Gina has mentioned. And then we outline all the tools that are available to them to help build their plan, and also how to do it. It's a bit hard to get your head around, and so this is an area that we've identified as that needs more support. And the second day, we sort of tend to talk about the interdependencies, which is the greater engagement that you need past the 5 Cs. Review the tools again, review again how to go about this, and we're obviously there to help them. And then we have the countries go into their own workshops, and so for the next couple of days, they're mentored to build their plan and where to start, what to do. Then on day 4, we go through sort of how much did you learn, and that's we have a couple of games during the week to keep people interested. Then in the afternoon, the countries present their progress, their challenges, and what their next steps are. And then we also give a presentation from the AFRA level to say how we can help you. So next slide, please. So at the end of the workshop, they essentially come out with a draft 0 of a plan. Maybe advanced, it may be simple, but at least it's something to start on and build on, and a roadmap of how to actually flesh that out, put flesh on the skeleton, so to speak. Next slide, please. So our progress to date is that if we include the PIP, the work we did under the PIP framework, we've had 31 countries out of 47 engaged in pandemic preparedness planning. And I have to say that from the group that did their plans in 2019, 2 countries actually had their plans validated by the Ministry of Health. To date, using the PRET initiative, we've engaged with 16 countries, and then the plan is to do an additional 14 countries before the end of 2023. And so that will actually total to 41 out of 47 countries in the region that have been engaged with pandemic preparedness planning and to support moving on. Because I think it's really important to capitalise on the memories of COVID and the experiences of COVID, so that, you know, we can capture all that knowledge and information in being able to plan better for the next pandemic. Next slide, please. In our workshop on day 4, I mentioned we asked the countries to give a presentation. They give a presentation on their progress. We asked them to find out, where they are with their draft and their skeleton, the challenges that they faced during the workshop. And this has been interesting because it's also given us useful feedback on how we can improve and what we need to do, say, for the next workshop, or where to change. And one of the key challenges was how to start this. So, and that's been something that we've taken forward to develop, resources or tools to help them to figure out how to start this, because we have had countries that have come at, say, level 0. We also asked them to give a presentation on a roadmap, and a roadmap that will help them finalise the plan. We encourage them to have a simulation exercise in it, multi-sectoral workshops, because they do need to engage other people, and then how to validate and endorse the plan. Most of the roadmaps have been very ambitious with respect to timelines, but that's a good thing. Better to be ambitious than not. And, we're working with countries to follow up so that we ensure that they actually do sort of move forward with this. And we've identified some champions through the workshops and the people who've attended who can potentially take this forward in countries. Next slide, please. So, as I mentioned, one of the challenges was how to start. And so we developed this slide, and I'm talking about my team, which is myself, Lionel, who's a consultant in Angola, and also Camille, who's a consultant here at the regional office, to help countries, get their head around it, sort of, what do you need? And also this gives them an idea of how to use the PRET module. Identifying what they have, and then using all the documents they have to help identify what they do have, and then look at what is missing. And countries use different approaches to do this. We had one country that did a very detailed SWOT analysis. Other countries start looking at their JEE or their SPA results. So it just depends based on a country, and countries are able to use whatever approach they want. And then, the last part is, what are the actions that you need to do to be prepared? We also help them sort of just identify what their triggers are going to be, which will move from each of the operational stages, and then the actions that they need to do to prepare. And this is looking at it in context with each of the 5 Cs and each of the operational stages of a pandemic. Next slide, please. So, as I mentioned, we talk about what is next for us as an AFRO team. We're going to provide technical support technical support to countries through the CIMEX or multi-sectoral workshops. I'm finishing up, Gina. Financial support, so that's help with elaboration of plans and tools. And, we're continually developing things that we can use to support countries, and also with advocacy, because we've identified that advocacy is one thing that is needed, particularly in countries. Next slide, please. And with that, I'm going to close. And these are just some pictures from one of the workshops we had with the countries, and that's the branding of the regional office here. Thank you very much, Gina.
Thank you, Belinda. That was fabulous. Colleagues, if you have questions specifically to this regional approach explained by Belinda so beautifully, please write them in the Q&A, and we'll take down the slides now and invite our 3 country panelists, as well as Belinda, to come on screen. And as they're doing that, let me introduce them. Dr. Cristian Zaragoza from Mexico. He is the Director of Epidemiological Information at the Ministry of Health. Welcome, Cristian. Dr. Rainer Wirth, Project Manager for Pandemic Preparedness at the Federal Office of Public Health in Switzerland. Welcome, Rainer.
Hello.
And Dr. Nadine Yared Marhaba, Infectious Disease Committee, Independent Consultant on Pandemic Preparedness for the Ministry of Public Health in Lebanon. Welcome, Nadine.
Thank you,
Can
ma'am.
we see you? Hi,
Yes.
good to see you. Thank you, everyone, for joining us. So this is a panel discussion. We're going to be informal. We have a question for you each. We'll keep it tight and sweet to give a flavor of what's going on in your countries. Cristian, can I start with you? Can you hear me, Cristian? Dr. Cristian? I believe we need to have volume.
Buenos días, la escucho.
Wonderful, thank you, welcome. Thank you for joining us, and I know you will speak Spanish. Thank you. So, Mexico is currently updating its pandemic preparedness plan. What are your capacity strengthening priorities? Planning is one thing, preparedness is the goal. So what are your priorities, and how did you identify them, Dr. Cristian? Over to you.
Muchas gracias. Buenos días desde el continente americano, ahora con una temperatura muy cálida, 15 grados centígrados en un verano boreal. Como ustedes saben, México es un país de 130 millones de habitantes. Es un país bioceánico y con características y determinantes muy específicas. Un país en donde la pertinencia cultural por nuestros grupos indígenas es fundamental, grupos vulnerables. Y definitivamente en este periodo nosotros tenemos que realizamos un ejercicio, sobre todo posterior a enfrentar el fenómeno en salud pública más importante de los últimos 100 años. Para este proceso de actualización de nuestro plan de pandemias por virus respiratorio con potencial pandémico, hemos estado apegados a la lista de verificación de la Organización Mundial de la Salud. Y definitivamente tenemos que partir de un diagnóstico situacional que nos permita identificar diversos componentes. Entre ellos, tenemos la planificación y coordinación, la vigilancia epidemiológica como un eje fundamental, fortalecida desde los laboratorios también, el manejo clínico, que resulta sumamente importante, la prevención de las enfermedades, obviamente con el componente de vacunación, la promoción de la salud y la comunicación del riesgo. Algo importante que la pandemia por COVID-19 nos ha dejado es esta continuidad de servicios. Y creo que el panorama nos da diferentes desafíos. Nos enfrentamos a largas cuarentenas, a jornadas de sana distancia, en donde la transición informática a través de los medios tecnológicos juega un papel fundamental que debe de estar plasmado en todos los planes para la continuidad de actividades esenciales. Posteriormente, la investigación y el desarrollo. Pero hay un fenómeno muy importante, la evaluación de los planes. aquí aprovecho para agradecer el acompañamiento que la Organización Panamericana de la Salud nos ha dado como país y como región en este tema en el cual es importante el realizar ejercicios de simulación, en donde tengamos identificados nuestros jugadores y nuestros stakeholders con diferentes escenarios. Creo que COVID-19, y estoy convencido como epidemiólogo, nos ha mostrado una cantidad importante de escenarios que tenemos. Definitivamente en este mapeo, en estas prioridades de fortalecimiento de capacidades, algo que quiero señalar y que toca desde el eje fundamental de la Organización Mundial de la Salud y a través de sus oficinas regionales, es el Reglamento Sanitario Internacional como un documento vinculante. Y estoy seguro que el Reglamento Sanitario Internacional durante esta pandemia se sometió a estrés. Y es momento en el cual tiene que estar revisando diferentes temas para prepararnos ante un siguiente evento pandémico. Creo que un tema importante también es el marco jurídico internacional y el marco jurídico local que permita niveles de actuación, la capacitación. Y como se mencionó a lo largo de este webinario, algo que hemos aprendido los sistemas de salud es la elasticidad. Aprendimos a crecer muy rápidamente, pero ahora, con el fin de la emergencia, tuvimos que desescalar. Y creo que un desafío y un reto muy importante es cuáles son estos indicadores que me permiten este desescalamiento. Gracias.
Thank you very much, Dr. Christian. Couldn't agree more on those lessons and priorities, including that key one about the innovations that have come through. So thank you for those inputs. Mexico is a champion country, including in the One Health space. Thank you. Let me turn to Dr. Rainer Warth from Switzerland. Rainer, again, like Mexico, you're in the process of updating your plan. You've been working intensively, as we've been discussing in recent months. Can you describe your process? And was PRET, the respiratory module #1, was it helpful to that thinking and that process in country? Over to you.
Yes, maybe I explain you our process in terms of more historical aspects. So we also had available the influenza pandemic planning, which was last reviewed in 2018. Then after pandemic, our commission, our parliamentary commission, made already some suggestions in 2021 how this could be improved, and also following the WHO recommendation that it should not be focused anymore on one influenza, more on different pathogens. Then in 2020 we had a first evaluation or collection of all the reports which were available, which analyzed basically the COVID-19 pandemic. And then from this base, in end of 2022, we created a project. So we are organized in the form of a project, which is with me as a project leader, but with 2 or 3 other people who help in the project. And our job is basically to find for each part of the new pandemic plan experts, which then review this part in their domain, basically. Right? It's not me or our team who is writing. We might edit some parts, but all together we create a pool of experts who take care of different aspects. Now, that's our process, and we try to bring at the end of this year up a first version. Right. So now to the second question about how is a PRET module helping us. First, it was important for us that it confirmed our approach, or basically what was asked for, to focus on respiratory pathogens, right? Second, it was important also to see that you really pay attention to innovations. So, for example, genomics, and I think in one slide you also talk about the bioinformatics part, but as well infodemic management. So that was two things we also discussed, and it was important for us to see that you also follow along these lines, right? And then, of course, we use it a lot to question our content of the plan, of our pandemic preparedness plan, and also to make sure we really consider all aspects, right? We also looked at the third point, basically, on your diagram, preparedness and responses. There we have maybe a little bit of a different view. In the response phase, we consider different pathogen situations. We might have a pathogen where we do have maybe already vaccination and medication available, which is a different situation. If we have a completely new pathogen, we might even have to find out exactly what is the transmission way, right? And we have no medication and we have no vaccination. Yeah, so we might, these two extremes, we really want to have this in our preparedness plan considered and worked out, so we can be prepared for any kind of situation.
Thank you, Rainer. I appreciate that point indeed about having the scenario planning. This makes complete sense in the sense of what is available, is it known, what do we need to learn quickly about these pathogens. So thank you very much for your thoughts and input. Let me now turn to Dr. Nadine from the Ministry of Public Health in Lebanon. Lebanon has done a lot of work in terms of taking a multi-sectoral approach, especially during a recent simulation exercise, Dr. Nadine. It was very exciting to see and hear more about that. So this is part of your process to update your pandemic plan. What have you learned about this multi-sectoral inclusion, the process, and what have you learned about including sectors in your preparedness planning process? Over to you.
Yeah, thank you. Good afternoon or good morning, everybody. Thank you for this opportunity to share this experience. So actually, we needed to review the plan. And so we had first to check about the gaps in the plan. And the plan, so far, the previous plan contained description of the units involved in preparedness, like the surveillance units in detail with its job description, the immediate response units, and the other units like the defense, the communication unit, the supportive committees, the healthcare. So all the units that would be involved in preparedness. But what we found, there were major gaps in the plan as it was, in the sense that the plan did not describe anything about how these units would collaborate between each other. So we elected to proceed to a simulation exercise, not a simulation test, because the plan was obviously had a lot of gaps. We elected to do a simulation exercise. And in this simulation exercise, we gathered all the units that would be involved in preparedness plan. So preparedness for pandemics. So there were people from the community representatives, all transversely up to going through the surveillance, going through the healthcare, going through the communication, all vertically up to the highest defense in the country. And these people were gathered in the same room, and we had an exercise. We discussed multiple case-based scenarios. So with every case-based scenario, each of those units, so let's say the veterinary unit, the defense unit, the medical unit, each of those units would voice out loudly their role and their responsibilities in this case scenario, the way they saw it. the way they understood it. So the result from this simulation exercise were the following. The simulation exercise shed light and gave answers to many of the gaps. So first of all, when every unit voiced out their role the way they saw it, then they realized what are the capacities and the limitations of each of those units. So the capacities and the limitations of each unit was already delineated and well understood. And the second point, not only they realized that what their role would be, because this was not very clear in the previous plan, they realized what their role would be, but each one of those units realized that there are other units with whom they should collaborate. So automatically, the collaboration between the units became clear, and the levels of collaboration became clear. Not only the levels of collaboration in between the units, but also the triggers and the levels of collaboration. For example, I, as a, let's say, as a representative of the medical body, let's say, at this point, I understood during the exercise, I understood what are my roles, what are my responsibilities in the pandemic preparedness. And also, I understood how to collaborate, when to collaborate with each one of the other units, when to collaborate with the communication unit, when to collaborate with the defense, when to collaborate with the surveillance unit, and so on. So the roles, the capacities of each unit became very well delineated. Collaboration mechanisms became clear to all of the audience, and also of the participants or partners, and also the triggers to what level of collaboration and what level of response became clear in relation to the case scenario. So if we were talking about a fake which is declared in a distant country with no risks to my country, then maybe it would be just the surveillance unit and then the communication as a response, and the communication team would involve would inform the community about the disease. But if it is a fake which is in a nearby country and there's a high risk of morbidity on my country from this disease, then it's a much wider response involving many more units, and probably the surveillance maybe at entry points, plus or minus control of entry points, involving maybe the defense, and of course the communication to the people would be at a different level, the content would be different. So all these specifics regarding the response in relation to the specific case scenario became evident and clear to everyone during the exercise. Now, that not only that, there was one more thing that became clear during the exercise, and that was, of course, everybody understood that they have to be prepared, but they realized that the response and the preparedness to pandemics is not really a one point in time preparedness event. They understood that beyond the pandemics, there should be capacity building for each of those units during the interpandemic periods. So that was very important. It's not being prepared for a pandemic is not a reaction to a pandemic declaration. It should be a preparation, and much more important in the interpandemic period was the preparations that were being done. So this also became clear to people, which was being done only within some of the units, mostly the surveillance and the immediate response, but not in all other units that would be involved in a preparedness plan, actually. So basically, through the simulation exercise, we could bridge many of the gaps between the elements that are involved in the preparedness plan. But one of the limitations of the preparedness of the simulation exercise was that it would not cover some of the gaps that are inherent to the system in the country. So for us, while reviewing the plan, we realized many points. One of the first point is that when we write down the preparedness document, whatever preparedness document we get, this needs to become a recognized binding document, a document that binds all those units, all these elements. And this document should be empowered by the highest governance at all times, and should be some kind of immune to any conflicts, because it relates to the welfare of the whole population at large. And this document should be made public. It should not be kept in the drawers of the ministries. Otherwise, it will not reach all the elements, all the units that are responsive to react in pandemic preparedness. Mm-hmm. And the second point, yeah, I'm finishing. The second point is that the gaps that we identified, some of them were in the preparedness plan against influenza per se, but a lot of them were gaps in the system itself. And that's why we elected to move somehow from an influenza preparedness plan to a preparation of a system. So a system preparedness plan that will denote all the elements, but also more importantly, that will describe in detail how these elements interact, how they collaborate in all phases of pandemics, in the interpandemic and in the pandemic areas. So basically, I think this is in alignment with the PRET, okay? In the instance, this is in relation to respiratory pathogens. Mm-hmm. And the other thing that also was evident to us while reviewing was that since the preparation to pandemics is not a one point in time process, it's a continuous process, there must be like repetition or regular meetings, to join these people together so that they keep the momentum that was created during that simulation exercise. And because some of the gaps are systemic, not tiny gaps in an influenza preparedness plan, that's why we hope to deal with those big gaps, the systemic gaps, in bridging workshops like the upcoming national bridging workshop, hopefully to be held in Lebanon in the coming months.
Oh, thank you, Dr. Nadine. This is wonderful, much appreciated. The collaborative nature, the interdependencies that Dr. Belinda Herring also raised really do resonate. Colleagues, Dr. Christian, Dr. Reiner, Dr. Nadine, thank you for those reflections. Indeed, I think this is the experience that we've heard from many countries around the world. And for those listening in this call, thank you. Seeing the chat, seeing the Q&A, there's a lot of common themes emerging. So with that, please know that the guidance is a living document. We'll build in expertise and knowledge as we go forward. There's the opportunity to engage in communities of practice, more simulations, the support from WHO and other partners, and most critically, please join us in a call in our next EPI-WIN webinar in September to think about how we can engage, how partners can engage, and seeing that there are lots of partners on this call, hearing from Dr. Nadine and from colleagues around the criticality of multisectorality, this is really a perfect opportunity. With that, let me thank you. Let me turn back to Dr. Supriya for closing out the EPI-WIN webinar. With great thanks, Supriya.
Thank you very much, Gina. And a huge thanks to all the presenters today. Excellent insights from all the countries and, of course, the region as well. I'd like to close today by thanking all the participants. thank you for introducing yourself and for your questions, which we will try and answer as far as possible. We see it on the Q&A. And we will see if we can get the answers back to you. But it's been great participation. I'd like to end by thanking the EPI-WIN team, Dr. Agnesi Pasterino, Dr. Priya Umachandran, Ms. Jiangfeng Liu, and Mr. Tim Nguyen for his support. I'd also like to thank the entire PRET team, Shoshana Golden particularly, but also Brittany Moran, Chris Chadwick, Tosin, and others from the team. And last but not least, Dr. Sylvie Briand for her direction and Dr. Gina Saman for her excellent lead on this webinar. Thank you very much and hope to see you in August, where we have 3 webinars coming up on dengue, on the Lassa fever, and on Zika. And in September, we have, as Gina mentioned, another webinar on PRET. So look forward to seeing you. And please complete your survey if you would like to get a certificate of attendance. Thank you. Bye-bye.